Hi, I'm Dr. Patrick Foy. I'm a MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, online at tailbonedoctor.com. In this video, we're going to talk about bone spurs causing tailbone pain or coccyx pain. This is the next in my series of videos going chapter by chapter through my book, Tailbone Pain Relief Now, to share some of the information that's in the chapter and to do that in a video format that's available online as it is here and allows us to interact more because you can post comments or questions or your stories down below this video. So this now is chapter 9 within my book. So chapter 9 is bone spurs causing tailbone pain. What we'll cover in this video is what is a bone spur, how does it happen, what is it made of, where is it located within the coccyx, and how does it cause pain. And we'll talk about a few other aspects as well. So first of all, what is a bone spur? A bone spur is when there's a little bit of additional bony material beyond the normal amount. One thing I compare this to sometimes is if you think about when you get calluses on your hands or feet, there's thickening of the skin that causes a callus of the skin. Well, similarly, there can be thickening of the bone causing a callus of the bone. And when that callus is located in a particular way that it forms a point, that is called a bone spur. Or some of my colleagues in Europe often will refer to it as a bone spicule. Same thing. So, if I show you here an illustration from the book, it probably will do a good job of showing you what we're talking about here. So basically, this is a side view of the coccyx or tailbone. So if we looked at the coccyx, like the sacrum and coccyx like this, normally you can see how the tailbone curves forward into the pelvis. But now in this case, it starts curving forward, but you can see here down on the lower end, there's a little bit of extra bone. I've highlighted in yellow here on the illustration just to make it more clear, where there's a little bit of extra bony material there. That is a bone spur or a bone spicule. And it's often relatively small, so you could say maybe smaller than the size of a pea or a pebble. But it can cause a lot of pain, just like the same way that a small pebble within your shoe would be very, very painful if you were walking on that all day. Every time you put your body weight on it, you would obviously have a lot of pain in your foot after a while from doing that. And similarly, when you have a bone spur the size of a pebble down here at the lower tip of the coccyx, that can cause a lot of pain as well, because every time that you go to sit down, basically you're sitting, if this is, I'll have the book represent the chair here, you go to sit, and now you're going to be pinching the skin in between the bone spur and the chair that you're sitting on. And especially if you sit leaning part way back, you're really going to be poking that bone spur down through the skin and down towards the chair. So the bone spur itself is made of bone. It is bone. Just like the callus that you have on your hands or feet is made of skin. It is skin. So a bone spur is made of bone. It's a thickening of the bone that forms a focal point. And where does it occur at the tailbone? The vast majority of the time, it is located down at the lowest tip of the tailbone. So the lowest tip of the coccyx is the spot where you see the bone spur most commonly. And the other question that comes up is, well, what direction, if it's coming to a point, what direction is that pointing? Typically, it's pointing behind you. So it's pointing backwards. So back to our anatomic model here. Again, this would be a model of the sacrum, and down here is the coccyx. You can see the whole thing is curving forward, but if there was a bone spur, it would be pointing back the other way. The bone spur would be pointing, back that way, the way that the pen is showing here. So that's a little bit about what the bone spur is made of, and where it's located, and the direction that it points, and the way that it causes pain, especially when you're tilted, leaning back. But even with sitting upright, it can often be very painful as well. The things that are done to treat the bone spur, we're going to talk about in some of the later videos when we're talking about treatments of various types of tailbone pain. The book is sort of divided so that the first half of the book is about the diagnosis and what it is that causes tailbone pain, and goes through a variety of different causes. And it's super important that prior to starting treatment, that you actually have a sense of what it is that's causing your tailbone pain in the first place. How is that assessment made when we're looking at bone spurs? There's 2 or 3 main ways. Number one, of course, listening to the patient's symptoms. They have pain at the coccyx, right in that area, pain with sitting, leaning partway back. Sometimes they may have some pain during transitions from sitting to standing. But those things are true about most causes of tailbone pain. The ways that you would distinguish the bone spur specifically would be, number one, on physical examination. If the physician is careful while they are touching, even just pressing externally along the back of the sacrum and the back of the coccyx, if there was a spur right here where my finger is, you may be able to feel that projection coming backwards. It's almost pointing, if this patient was laying on the table here, and they're facing down towards the floor or the table, their back is pointing up towards the ceiling here, and in this example, the bone spur, would be here, pointing, somewhat up towards the ceiling. And just from a careful physical exam, just gently pressing along the back wall of the sacrum and coccyx, you can kind of walk your finger down, and you can sometimes feel the spur pointing upwards. So another way you can assess for that is by getting imaging studies. Most commonly that's done by x-rays or radiographs, and it's important that they do the side view and not the front view, because the side view will show you that silhouette that will show if there is a bone spur sort of sticking out. And we'll talk more in another video covering another chapter about the different tests that are done for tailbone pain. You can see it on x-rays, MRI, CT scans, etc., but only if any of those tests are done properly. Unfortunately, a large percentage of the time, the imaging studies are not done properly. That's a general scoop about bone spurs causing tailbone pain. Obviously, there's a lot more information within that chapter within the book, but I wanted this video to provide us an opportunity to generally cover the topic, and also for you to post your comments down below, comments or questions or thoughts, or if you've had a bone spur someplace else at your shoulder, or sometimes people get them on the sole of their foot with plantar fasciitis. It's the same idea, that bone spur, that pointy projection of bone, starts to pinch things. So at your shoulder, it pinches into the rotator cuff muscles when you try to reach up overhead. At the sole of the foot, it pinches the skin when you take that first step in the morning and press down. It can pinch the soft tissue structures on the sole of the foot. So that's a little bit about bone spurs. Post your comments down below, and if you're interested in getting the book itself, the easiest way to get that is to go to the website www.tailbonebook.com. It is available on Amazon, but if you go to tailbonebook.com, it will give you the direct link for the Amazon site for your country, whether you're getting the ebook, which is available worldwide. You do not need an ebook reader. You can just read it online. So any place that has internet access, you can get the ebook, and also the paper copy, the soft cover copy you can get through Amazon. And again, use the links at tailbonebook.com. If you're looking for me, you can generally the easiest way to find me online is at my website, which is www.tailbonedoctor.com. So I have lots and lots of educational content, videos, online articles, etc., all related to tailbone pain. Or if you're looking to come to see me, all of that information is there as well. Okay, thank you. Bye-bye.